Now, this is breaking news from the WCCO Live Desk on CBS News Minnesota.
I'm Maria Lizignoli. We're going to take you live to the Minnesota State Capitol, where Governor Tim Walz is going to roll out a comprehensive anti-fraud legislative package. We take you there live now.
The best place in the country to raise a family, the best place to live, best way to start a business. And a lot of those indicators and those measures are still holding true to that. We also know that if we're going to have these public programs, we need to have program integrity in it. And we have been working at that for years to make sure and to be very clear, any dollar of state money, especially those being used for programs to enhance people's lives, if that goes to the wrong place, is misspent, or in the case of this, criminals are stealing it, we need to do everything possible to prosecute that. And we've done that here. There's nearly 100 people that have been tried and convicted and are serving time in prison right now. We've taken meaningful steps, whether it be through executive orders, strengthening DHS leadership, engaging independent experts and auditors, and expanding investigative and enforcement units to guide stronger prevention. We do this work not to find headlines, because when you're fighting fraud and convicting people, it's in the headlines. But that work needs to go on, and you've seen an acceleration of that because of the work of the people you're going to see behind me. You're going to hear from DHS Commissioner Gandhi, you'll hear from our Inspector General Clark, and then you'll hear from BCA Superintendent Evans. But I want to make clear at this, the tools that we have and we've made progress on, we put these things forward to the legislature. The proposal that you have there in the package, many of them, if not all, should be incredibly acceptable to Democrats and Republicans across the board. Many of them have been suggested by both of them. We have suggested them. We were not able to get some of them through the legislature. So this is a bipartisan effort. But we're kind of at a crossroads on the fraud fight. We saw an incredibly damaging continuation of the reckoning and retribution campaign by the Trump administration, a totally illegal and unprecedented in this country's move around Medicaid. And you're going to hear again from the team that's here can explain what's going on with CMS, with Dr. Oz, and then adding the vice president into this, even though, and you'll hear from this, Minnesota's Medicaid error rates are about 2.1%. The national average is 6.4%. There's absolutely no reason, and we're in the middle of working with them, even though we've met, I believe, all of the criteria of an improvement plan in their parlance, I guess. And what they did last night was just another step on that. It is absolutely not serious. It's not meant to fight fraud. How taking health care from 400,000 children, pregnant women, and the elderly, I would ask all of you, did you hear in there what specific steps they were going to take to stop the fraud, or what the specific fraud they were talking about? They're using it as a general term in this, and they're not serious. So we're at a crossroads here in Minnesota. If you like talking about fraud and you think it's an electoral issue for you, that's gone. I'm not running. That's gone. If you're serious about fighting fraud, you can help us work on this package, get this package passed, give the tools necessary to the folks so they can continue to do what we're already seeing, enhanced program integrity that my role was. You saw in Tim O'Malley, who I want to thank again, report that this is something that has plagued governors going back 50 years. Other governors have dealt with fraud. I want to be the last one to deal with it. I want Minnesota's modernization around program delivery to be the strongest. But right now it appears to me that the Trump administration is not serious about that. They're continuing to try and wage this conflict against Minnesota. There's nothing in their plans that works. I continue to hear from the legislature platitudes and mysterious things. Republicans need to be very clear. Do you want to fix it or you want to talk about it? Because it appears to me right now is that they fear fixing this because it takes away what they think is a political leverage. And that is simply wrong for Minnesotans. I've already told you we're taking accountability. We're seeing the fixes. The results are starting to show themselves. This package is needed. I asked the legislature to do it. Not going to make everybody happy. It shouldn't, because we've been told by outside auditors that there are vulnerabilities in the program. The experts have gone back and said this package will close those loopholes, and that will move us forward. So we're in a good spot, I think. I'm hopeful that we're getting this out there, but we're also fighting two fronts on this Medicaid move. I don't know how to really express just the timing of this, the nature of it, the sense of retribution. No state has experienced this before. How does taking and punishing children and elderly have anything to do with fighting fraud when that's not where this issue is taking place? It does nothing, and they've given us no way to try and show that all the things they asked us to do we've already done. They're not even looking at that. So we've got our work cut out for us, but I'm hopeful on this. I'm not just hoping for a better outcome. We planned for a better outcome. So with that, I'm going to turn it over to someone who took this job on, took it on as a temporary place, had the opportunity to retire, but chose to serve the state. And I think by all accounts, we're seeing both here and in Washington, D.C., the competency of DHS Commissioner Gandhi is making a huge difference. And quite honestly, it's a tough lift because it's also making a culture change that the commissioner has been, I think, very successful at. With that, Shireen Gandhi.
Thank you, Governor. Shireen Gandhi, serving as Commissioner of the Minnesota Department of Human Services. Today, for all the controversy surrounding fraud in state programs, we also have the opportunity to make Minnesota a national model for combating fraud, waste, and abuse. Governor Walz is leading that effort, and for the past year, I have been working to do this, and I will continue to accelerate change within DHS to prevent and fight fraud. We have a consensus around an outcome: zero fraud in our programs. So it's time to think big and act boldly. This week, the Minnesota Program Integrity Director, Tim O'Malley, provided his roadmap report. He found that more than 50 years of neglect of program integrity and oversight efforts created the conditions that bad actors have exploited. He said the state has a lot of work to do to make the next half-century better. The governor's executive order, issued in September of last year, accelerated the work that DHS can do as a state agency. But we can't do it alone. As you've heard me say before, there are important changes that require all of us to come together. We need the support of legislators, and we need to tackle these issues during this current legislative session. The governor's plan covers a lot of important ground. For the Minnesota Department of Human Services, it will strengthen our hand in working with managed care organizations. The health plans in Minnesota handle about 80% of Minnesota's Medicaid enrollees. The governor's plan calls for enhanced oversight and increased review of claims that are being paid. We're also tightening oversight of the way we provide services to people with disabilities and older Minnesotans. We're establishing billing limits, new billing limits, requiring providers to keep digital records documenting services provided, and requiring pre-authorization for some high-cost service plans. Last year, we implemented reforms to the Early Intensive Developmental and Behavioral Intervention Program, which cares for children with autism, including the ability to do on-site visits when the provider has not submitted claims. In this legislative session, we are asking for the authority to expand that same ability to do on-site visits to other healthcare programs. There are over 1.2 million Minnesotans who depend on Medicaid services for life-saving and life-enhancing medical care. Almost half of them are children, as the governor noted. We owe it to them to come to the Capitol and have the frank discussions necessary to ensure that they have the care they need. Thank you.
I think we'll turn to Inspector General Clark.
Thank you, Commissioner Gandhi, Governor Walz. I'm James Clark, the Inspector General at the Minnesota Department of Human Services. I think we all know Medicaid services are vitally important for the people of our state, and we must do everything we can to prevent Medicaid dollars from ending up in the hands of criminals. To that end, throughout the past year, we have taken aggressive action everywhere we have found evidence of fraud. We've shut off payment to 540 Medicaid providers last year and made over 300 referrals to law enforcement. We are doing more than ever to root out fraud, and we have very strong partnerships with the BCA and the Minnesota Attorney General's office. But fighting fraud requires resources and tools. and the governor has put forward important proposals that will strengthen our investigative and enforcement authority. You heard some of these from Commissioner Gandhi, but some of the proposals in this package that will greatly help our work at the Department of Human Services are enhanced technology to detect fraud earlier and more efficiently, increased staffing for investigations, clear and enforceable policies relating to billing limits in some of these high-risk programs, and as the Commissioner said, more resources for enhanced oversight of managed care organizations that oversee Medicaid delivery to about 80% of Minnesotans. I just want to note, Medicaid oversight is a shared responsibility. DHS has responsibility, I have responsibility, but the legislature also shares responsibility in finding solutions to the problems we face. And at this moment, Minnesota needs the legislature to act to provide additional tools and resources that will help prevent fraud. That's all I have.
Thank you, everyone. Thank you, Governor. My name is Drew Evans. I'm the superintendent at the Minnesota Bureau of Criminal Apprehension. Under Executive Order 2501, the governor ordered all state agencies to combine the criminal investigative resources to combat fraud, a process we've been working on over the last year and was later codified by our legislature last year. That team, consisting of dozens of agents and analysts, continue to combat criminal fraud as those cases are referred to us. As Inspector General Clark noted, there's been a strengthening of our partnerships with the Inspector Generals and a team that's working together to look for fraudsters that are across the spectrum as they work to stop payments, take administrative sanctions, and when appropriate, to criminally investigate those cases. That team continues to work and operate, and part of what's being contemplated today are continuing the iterative process that will continue to be necessary in Minnesota to combat fraud, not only in our government programs, but in general as fraud continues to be a challenge across the spectrum for everything that we do. That team focuses on wage theft, insurance fraud, criminal investigative fraud, that is general financial crimes, and then state program fraud. Part of what's being announced today are expansion of some of our subpoena authority to be able to more quickly move these cases through the criminal investigative process. In that, and the authority that would be vested to ensure that we get the records in a timely fashion so that they move through the process as quickly as possible. Expansion of identity theft definition in Minnesota. One of the things we say, not necessarily in these programs, but we're starting to see AI being used as a tool for fraud, using the likeness of other people, voices to access all of our funds, whether it be in the traditional banking industry, insurance fraud, or in-state program fraud. And then extension of the statute of limitations for various different crimes such as securities fraud, failure to pay over state funds, presenting false claims to a public officer, theft by swindle, receiving stolen property, and fraudulent statements made to injure or defraud from the 3 years that most of those are now to 7 years, meaning that you will not escape simply because it takes a long time for us to investigate these cases, as they often take years to discover, and then additional staffing to provide additional focus on all of these types of fraud across the spectrum in that unit as they continue to work. That section at the BCA is our largest section right now, showing the seriousness of what all of us are taking to combat criminal fraud across the state of Minnesota. And as the governor and others have noted up here today, the theft of our public funds in particular is particularly egregious because we have individuals preying on the good nature of Minnesotans, taking those funds for their own selfish purposes, while those Minnesotans that these programs are designed to utilize are now, as has been alluded to, being frozen in some situations and not available for the purposes that they were intended. So as you see today, not only with DHS, but there's a number of different state agencies taking an all-government approach to root out waste, fraud, and abuse in our government programs, and we're committed to continuing to do that.
And I'd just like to say that this approach, and as you heard from increased penalties, enhanced opportunities to use AI, investigators being out there, changing some of the rules we have, asking the legislature to help us with this, all the things that have been identified as problems, this is a solution to it. So the White House solution to this is to take health care from poor people. Our solution to it is catch these people before they do it, and if we don't, to lock them away for a long time. Much more practical, actually gets to it. But I'll have to say, this Medicaid money grab and retribution, it's the same pattern. They used false information as a pretense to do Operation Metro Surge. They're using false information or no information as a pretense to take our tax dollars from a state that has some of the best outcomes in the country on health care, has some of the lowest error rates on Medicaid, and now asking us to turn away people who need that health care. So I'm real proud of this team. I think we got a great package here. We need the legislature's help, but as I said, this should be hugely bipartisan. And the only reason I think you wouldn't make a move on many of these proposals is you like to talk about fraud rather than fixing it.